When we consider when we first started out, back in October of 1999, and we were working in a small office, basically using empty cardboard boxes as desks, I don't think any of us would have envisioned kind of where we found ourselves now in the beginning of 2014.
We had an opportunity to break out on our own and really pursue our own vision as to what a world-class reproductive endocrine department should really look like.
And in fact, we were really just a bunch of academic geeks. We were at a small community hospital in the region at St. Barnabas and grew that into a substantial program in the mid to late 90s, but felt the need to grow a stronger research component and to have a more aggressive profile in terms of implementing and developing technologies to help our patients.
Our research facility is really unparalleled anywhere else. There's no other IVF clinic that has the facilities that we do in-house to perform research and also to translate new technologies to actual clinical use. It's really a unique environment.
A big component of our success rates are based on the embryology lab. So you want to go to the best lab that you can find. And so that's probably the #1 reason to come here.
We're one of the best labs in the country. First of all, we have the resources available to us to have the equipment and the technology at our disposal that we need to be good. We have 77 incubators in our lab, which is unheard of.
Over the last 15 years here, the implantation rate, the probability that a single transferred embryo will become a baby has more than doubled. And in each case, virtually all of those technologies were developed right here at RMA of New Jersey. Many of those technologies are now used all over the world.
The development of CCS really does demonstrate our leadership because of the way we validated it. We didn't just, have a great idea and develop a great technology, which is true, but we actually did many levels of studies to validate that it was effective and safe before we began offering it routinely to our patients. So it was a very thought out and safe approach, and once we were convinced that it really worked, now we've introduced it routinely to our patients.
It's a very exciting place to work. It's always changing, ever growing. I learn something new every day. Every day.
Much of the images you see on the wall behind you in many of the publications are for truly novel things. There are many areas of our field of medicine that are simply uninvestigated. Answers are unknown. And because of that, we felt the need to go get those answers. We felt the need to develop the technologies that allow us to effectively address those questions and find ways to improve our outcomes.
RMA is a unique setting because the idea of being able to do research that's real-time and then gets applied to clinical care is something that's not done everywhere.
CCS is a technology that was developed here at RMA, New Jersey. What it allows us to do is identify embryos that are most likely to succeed. So CCS stands for Comprehensive Chromosome Screening, and the most likely reason why any individual embryo won't give us a good result is because the chromosomes are not normal.
RMA feels that we have an obligation to try to advance the field. The vast majority of our patients conceive and deliver today, but there are still some who do not. The fight goes on. We're going to solve those problems.